Welcome to today's Explainer. We're diving straight into a literal medical detective story today. We're tracking down a hidden, super fast-moving threat known as uterine sarcoma. We're going to unpack some absolutely brilliant insights from Dr. Yoshi's medical breakdown of this disease, exploring exactly how it hides, how it completely tricks the body, and most importantly, how medical professionals actually hunt it down.
So here is our roadmap for today. We'll be looking at the hidden medical threat, cancer versus sarcoma, the fibroid disguise, spotting uterine sarcoma, and finally, treatment and next steps.
All right, Section 1, the hidden medical threat. Let's get right into this detective story.
So most of us have heard of typical uterine cancer, right? But a sarcoma? That is a highly aggressive tumor that hides deep down in the uterine muscle. It's not sitting right there on the surface, it is buried deep inside the tissue. And because of that sneaky location, it can grow and progress unbelievably fast without giving you any early warning signs at all.
To really understand the sheer urgency of this disease, we have to look at the survival timeline. The 50% survival rate for uterine sarcoma is remarkably short, literally just 28 to 31 months. That means within roughly 2 to 2.5 years of developing this, half of the patients succumb to the disease, which is exactly why early detection is absolutely vital no matter how good it is at hiding.
Now, while certain types of sarcomas, like carcinosarcomas or leiomyosarcomas, typically target older women, say in their 40s to 60s, there's actually a really rare variation called endometrial stromal sarcoma that can strike younger women too. So this is a threat that spans across totally different age groups. Vigilance is crucial for pretty much everyone.
Moving on to Section 2, cancer versus sarcoma. There is an absolutely crucial difference here.
And that crucial difference really comes down to a matter of geography. When we're talking about standard uterine cancer, it starts on the surface layer of the organ, the endometrium, the bed for a developing baby. But a sarcoma, that starts deep inside the thick, structural muscle tissue of the uterus. We're talking about a difference of mere millimeters, but that tiny shift in location changes literally everything about how the disease acts.
Dr. Yoshi uses this absolutely perfect analogy for this. Think of a piece of meat. Standard cancer comes from that very thin outer surface skin. But sarcoma comes from the thick, meaty part underneath. It's such a brilliant way to visualize why two diseases, right there in the exact same organ, behave so radically differently.
Because it starts deep in the meat of the organ, routine endometrial cancer screenings are going to completely miss it. Think about it. A standard screening just scrapes the surface layer of the uterus looking for abnormal cells. But if the danger is growing deep inside the muscle wall, that surface test, it's going to come back perfectly clear. It gives this false sense of security while the sarcoma just keeps growing totally unseen.
All right, Section 3, the fibroid disguise. This thing is a total master of deception.
This is where it gets incredibly tricky for the medical detectives. You see, both harmless, benign uterine fibroids and deadly, malignant sarcomas grow in the exact same deep muscle tissue. When a doctor is looking at an ultrasound, they both just look like mysterious lumps in the muscle. That makes them incredibly difficult to tell apart at first glance.
There's another great analogy for this. They graduate from the exact same high school, but one is a good guy and one is a bad guy. Fibroids and sarcomas both start in that exact same uterine muscle, but one goes on to be totally harmless and the other becomes a deadly criminal. The massive challenge for doctors is figuring out exactly who they're looking at.
What's truly alarming about this disease's path of destruction is that it doesn't just slowly seep out. No, it breaks straight into the bloodstream and metastasizes rapidly. And shockingly, it frequently travels straight to the lungs first. So imagine this. Someone goes to the doctor with just an unexplained persistent cough or a lot of phlegm. The doctor takes a chest x-ray, sees masses in the lungs, and traces it all the way back to a hidden sarcoma down in the uterus. So yeah, an unexplained cough might actually be your very first clue.
Which brings us to Section 4, spotting uterine sarcoma. How do doctors actually find it? It all builds into this very specific diagnostic protocol. Step 1, doctors notice sudden, rapid growth on an ultrasound, like a mass jumping from 5 centimeters to 10 or 20 centimeters super fast. Step 2, they run blood tests checking for specific muscle breakdown markers. Step 3, they order an MRI to literally look inside the mass. And Step 4, the ultimate confirmation, surgical removal. Let's talk about that blood test for a second. The LDH marker goes up whenever muscle tissue breaks down. Since the sarcoma is actively destroying uterine muscle, this marker naturally spikes. But, and here's the catch, a positive test could mean a sarcoma, or it might just mean you went on a super intense hike or lifted some really heavy weights yesterday. It's a great clue, but it's not a standalone answer.
That's exactly why, if the ultrasound and blood tests look suspicious, doctors bring in the heavy machinery, the MRI. And the MRI is looking for something very specific: rot. Because sarcomas grow so incredibly fast, they literally outgrow their own blood supply. This causes the inside of the tumor to bleed or become necrotic. It just rots right from the inside out. If a doctor sees that necrotic tissue on the scan, red flags go up absolutely everywhere.
So, if a sarcoma is this fast-moving master of disguise, how did doctors ultimately defeat it? The clues have been gathered, the disguise is blown. What's the plan of attack?
Let's look at Section 5, Treatment and Next Steps. The intense protocol.
The primary line of defense here is swift, and it is surgical. The protocol involves completely removing the uterus and both ovaries. And this is really unique because the surgery actually serves two distinct purposes. It eliminates the primary source of the disease, and it gives doctors the actual physical tissue they need for the final conclusive diagnostic test. It's how they confirm 100% that they're dealing with a sarcoma.
Now, this brings us to one of the heaviest realities of the disease. Because that 50% mortality timeline is so terribly short, doctors literally have to act immediately. There just isn't time to pause and weigh options. So preserving fertility, unfortunately, has to take a backseat to the absolute immediate priority of saving the patient's life. The sheer aggressiveness of the tumor dictates the response.
And the fight doesn't end in the operating room. Because this disease absolutely loves to hitch a ride on the bloodstream up to the lungs, microscopic cells may have already escaped before the surgery even happened. That's why aggressive chemotherapy is heavily utilized as the mandatory next step. It acts like a systemic net, hunting down and completely destroying any of those rogue cells that tried to flee the scene.
We've seen exactly how this hidden threat operates. It hides deep in the muscle. It perfectly mimics harmless fibroids, and it moves with terrifying speed. But knowing how it disguises itself, that is your absolute greatest power. When you understand the signs, like sudden internal growth or strange, unexplainable things like a persistent cough, you can advocate for yourself. So I'll leave you with this. How will you use this knowledge to stay vigilant and pay closer attention to the sudden, hidden changes in your own body? Thanks for joining me on this explainer, and keep learning.